Next, we'll do the musculoskeletal system. If you could extend your arms out, good. No deformities noted, no swelling, equal in length. Any pain?
No.
Tenderness?
No.
Good. I'd also like to check your legs, if you could straight out. Again, equal in length, no deformities noted, no nodules noted. Any pain?
No.
Good. Next, I'm going to check your range of motion against gravity. I'm going to start with your jaw. Can you open your mouth for me? Move it from side to side. Protrude the bottom jaw out and then back in. No popping noise, good range of motion. Next, I'll do your neck. If you can put your chin to your chest, look up to the ceiling, and then from side to side for me. Good, full range of motion. Next is your elbow. If you can first curl it in, curl it out. No epitrochlear nodule noted. I would also do this bilaterally. If you could, I'm going to check your wrists now. If you can point them down, now up, inwards, and outwards. Good, full range of motion. Your fingers, if you can go in a fist, then expand the fingers out, and then back in. Good, full range of motions. Next, I'm going to check your hips. I would like you to bring your knee to your chest as close as possible, and then outward, inward, and crossover. Good. Any pain?
No.
No popping noise noted. Full range of motion. And again, I would do this bilaterally. Next, I would like to do your ankles, or I'm sorry, your knees. Bring your legs up, down, and then swing them from side to side. Good. And next will be your ankles. If you could put your feet to your floor, to the ceiling, inward, outward. Good. And now your toes, if you can expand them out, and then curl them in. Full range of motions noted. Next, I would like to do your back. If you could stand up for me. Okay. And then I would like you to go ahead and bend forward to touch your toes. Normal curvature to the spine, noted. And then if you could swing to your left, and then to your right, and then back up to me. And now extend full back. I got you. Good, no problems. What I want you to do next is we're going to check your shoulders. If you can go ahead and raise your arms up, and behind your back, put your hands, your neck I should say, and then back down, and then back, and cross over to your blade. Good. And then put your arm back down, and then raise them up for me as abduction. Good. And I'm just going to check for your axillary nodules. No nodules noted. Good. Go ahead and step back. Have a seat. I'm going to check range of motions against resistance. What I need you to do is curl your arms up, okay? And I want you to resist my pull, okay? And now I want you to push against. Good. 5+. Now I'm going to check your legs. If you first try to raise your legs up, good. And then also your lower legs, good. Press inward, and now outward. Good. 5+ in strength. Now I'm checking for your rapid alternative movement. What I need you to do is put your hands down, and I want you to slap your thighs. Good. As fast as you can. Perfect. Also, I want you to take your fingers, your fingertips, and go as fast as you can. Good. Good range of motion. Lastly, I'd like you to squeeze as hard as you can. Full grip, equal bilaterally. Thank you very much. Next, we will be doing the neurologic. Okay, first I'm going to test you for light touch, pain, and sensation. So what I need you to do is close your eyes and tell me now when you feel something.
No. 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 No.
Good. Next I'm going to test for pain. Keep your eyes closed.
Okay.
This is sharp and this is dull. Tell me which one is which.
Dull. Sharp. Dull.
Next, I want to test for your sensation. I'm going to place something in your hand. I want you to feel around and tell me what that is.
It's a key.
Good. Next, I'm going to write a number and you tell me what that number is in your palm.
3.
Good. Good sensations noted. Next, I'm going to test your deep tendon reflexes. First, I'm going to start out with your bicep. Good. Brachioradialis. Good. Tricep. Good. Your patella. Relax that. Okay. Your Achilles tendon. There we go. And again, I would do this bilaterally. Lastly, I'm going to check for the Babinski sign. Good. Negative for Babinski. Okay. I'm checking for sciatica. What I need you to do is raise both legs straight out, and then I want you to point your toes to the ceiling. Good. Any pain?
No.
Okay, go ahead and relax. Next is genitalia and rectum. I would respect the patient's privacy and don on gloves. I would first check for inguinal and femoral hernias. I would begin by asking the patient to bear down, which increases the abdominal pressures, which makes it easier to detect for hernias. At this time also, I would check for lymph nodes for mobility and tenderness. In inspecting the genitalia, I would inspect for discharge, lesions, masses, rash, swelling, or any abnormalities. I would inspect the skin color. If the patient had a foreskin, I would ask them to retract the foreskin. I would palpate the any abnormalities of the penis for tenderness or masses. I would lift the scrotum at this time and note for any swellings, lumps, or veins. Next, I would palpate the testes and epididymis. This should feel nodular and cord-like. And inspecting the perineal area next for skin integrity, lesions, rashes, masses, and swelling again. For the rectum, again, we would check for hemorrhoids, skin integrity, lesions, and masses and swelling. To assess for prostate, hemorrhoids, or fistulas, we would do a digital rectal exam at that time. I would ask the patient also if he does self-testicular exams. If not, I would begin patient teaching with him. Okay. For females, I would ask about breast exams. I would instruct them to do this a week after their menstrual cycle, picking a day that is like their birthday, something that they would remember. I would have them inspect for skin color, thickening, size, symmetry, contour, any dimpling, masses, or flattening of the breast. The nipple size and shape and the direction of the nipple I would inspect, and also rashes, alterations, or any discharge from the nipples. At this time, I would finish the exam. I would remove my gloves and wash my hands. And this ends my final. Thank you very much.
Welcome.